Welcome back, viewers. I'm Dr. Rex and welcome to HealthConcern channel. In today's video, we will be talking about the effects of stroke on the human body. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. We all have health scares at a certain point in our life. Just hope it's never a stroke. A stroke is a medical emergency that requires quick treatment. Early action can reduce brain damage and other complications. If untreated, it will hurt your movement, speech, emotional health or brain function, and in some cases a stroke could also cause death. In today's video we'll discuss what the serious effects of stroke on the human body. What's the impact on your nervous system? How are the muscles affected? We will discuss all of this and more. Also known as brain attack, a stroke is as serious as heart disease. Most often stroke occurs when blood flow to the brain stops. This happens when the flow is interrupted, preventing brain tissue from getting oxygen and nutrients. Brain cells get damaged and can die if left without oxygen even for a few minutes. A stroke can potentially affect several parts of your body. Well, after the event is over, the brain is an extremely complex organ that controls your body functions. If a stroke occurs and blood flow can't reach the region that controls a particular function, that part of the body won't work as well. For instance, if the stroke occurs at the back of the brain, your vision will probably be affected. A stroke depends on the location of the clot and the amount of brain tissue affected, but because one side of the brain controls the opposite side of the body, a stroke affecting one side will result in neurological complications on the side of the body it affects. The best chance of reducing damage caused by a stroke is to get medical treatment as fast as possible. Long-term symptoms and recovery time will depend on what areas of the brain were hit. Here's what happens to different parts of your body after a stroke. Number 1. Respiratory system. Stroke is the third leading cause of death in the United States. Breathing issues are quite common. After one has occurred, the nature of the respiratory disorder depends upon the severity and side of the injury. These disorders can be caused by the weakening of respiratory muscles and chest movements. The loss of muscular synergy will stop you from breathing as easily as you did. A recent study found that after 36 hours of hospitalization, 15% of stroke patients had acute lung injury. And 8% of those patients developed pneumonia or bronchitis. Acute respiratory distress syndrome also occurs in stroke patients. This is accompanied by trouble swallowing as well as gastrointestinal issues. Do you know any effective home remedies to deal with respiratory issues? Sound off in the comment section and start a conversation with our HealthConcern community. Number 2. Circulatory system, also known as the cardiovascular system. This part of your body is greatly damaged when stroke happens. It includes 3 individual systems that need to work hand in hand. These are the lungs, the heart, and the systemic. Our brain regulates all bodily functions. Cardiovascular control is no exception. The effects of a stroke on the circulatory system can be very serious. Sometimes they are even fatal. Studies show that within days following a stroke, heart problems are more likely to occur. I'm not just talking about a heart attack, there's also congestive heart failure, abnormal rhythms, and cardiac arrest to worry about. Irregular heart rhythms can cause blood clots. These clots move into the bloodstream. If they reach the coronary artery, they could cause a heart attack. If they reach the brain, they can cause another stroke. Chemicals released into the bloodstream after a stroke will hurt the heart. Feeling like you're missing out? Make sure you join our viewers by hitting that subscribe button and staying up to date on all of our great HealthConcern content. Number 3. Muscular system. Depending on the area of the brain damaged, a stroke can hurt different muscle groups. The severity varies from person to person and usually requires rehabilitation to improve. The brain controls both involuntary and voluntary muscle activities. This is done by sending neural signals to the muscles. These messages originate in the motor cortex found in the frontal lobe of the brain. The motor cortex transmits signals to the spinal cord where they reach the motor neurons. These neurons fire, allowing the impulse to travel to a specific muscle, telling it to either contract or relax. When this process is disrupted by a stroke, it can cause harmful changes in muscle function. Hypertonia, low muscle tone, and muscle atrophy are some of the muscular issues related to stroke. Stroke is the leading cause of paralysis. About 34% of paralyzed people have suffered a stroke. Approximately 80% of people who have had a stroke have to deal with hemoparesis. This is the inability to move on one side of your body. About 20 to 40% of stroke survivors experience some form of muscle spasticity. This is when your muscles feel really tight. When you suffer a stroke, the ability for your muscles to perform is limited. Number 4. Nervous system. The nervous system comprises the brain network of nerves and the spinal cord. This system is responsible for sending signals back and forth from your body to your brain. When the brain is damaged from a stroke, these messages are not transmitted accurately. You may find it more painful to perform your usual activities. This could be cooking, cleaning, or basic movement, anything you regularly did before the stroke. This happens because the brain might not understand the sensations the way it did earlier. You may also see changes in your vision if the stroke has hit the part of your brain that communicates with the eyes. The issues might include loss of vision, losing one side of vision, or problem with moving your eyes. There can also be processing problems. This shows you that the brain is not getting the right information from the eyes. There's an overlap between the area of the brain and their function. Foot drop is a common type of weakness and paralysis brought on by a stroke. This situation makes it difficult for the person to lift the front part of the foot. You might have to drag your toes along the ground while walking, or bend at the knee to lift the foot higher. This will keep it from dragging. This is usually because of the nerve damage caused by the stroke. It may improve with rehabilitation. Damage to the right side of the brain can cause loss of attention, focus, and memory issues. You may also have trouble recognizing faces or objects even if they are familiar. It can also result in behavioral changes like impulsiveness and depression. If the stroke damages the left side of the brain, you may have difficulty speaking and understanding language. Not only that, but memory problems, trouble organizing, and poor speech. Did you know stroke is a major risk factor for the development of epilepsy, especially in the elderly? Number 5. Digestive system. During the early days of your recovery, you're not going to be as active as you usually are. You'll be prescribed multiple types of medicine. Constipation is a common side effect of some painkillers. You'll also have problems drinking certain liquids. Stroke is the most common cause of neurological dysphagia. This is a fancy word for trouble swallowing. Up to 50% of patients with stroke have been said to have dysphagia. Bladder and bowel movements are common after a stroke. If you lose consciousness during your stroke, you could soil yourself without even knowing. A stroke will also damage the parts of your brain that controls your bladder or bowel. Pee retention can also happen soon after a stroke. This is when you have trouble peeing. As you can probably tell, strokes are serious. Did you know that there are different kinds of strokes? Each has a different effect on your body. The symptoms and treatment can vary based on the type of stroke and its severity. Some people recover completely while others have a disability. Seek immediate medical attention if you notice any signs or symptoms of a stroke, even if they seem to disappear quickly. Here's what you need to know. Do you or anyone you know suffer from a stroke? Let us know in the comments below. Thanks for your time. Don't forget to subscribe and like the video for more contents like this one. Bye for now.